Studies have shown that teens are beginning to experiment with drugs at younger ages more than ever. Teens are beginning to experiment with drugs that are much stronger than marijuana, and some can be highly dangerous when ingested the wrong way. Some teens will experiment with inhalants, bath salts, or other drugs, but the most addictive drug and potentially fatal that teens are using today is prescription medication. Aside from alcohol, these drugs are some of the most easy to get a hold of because they're prescribed by a doctor or kept in the home. Teens are finding that different types of medications give them different types of highs. Medications used to treat anxiety or pain can bring them down. But medications used to treat symptoms of hyperactive disorders act as stimulants and are typically used while drinking in order to not get intoxicated too quickly. These medications are designed to help treat symptoms of mental disorders or pain, but they can also be highly addictive and dangerous. With addiction to pain medications, there eventually comes a time when users are unable to feed their addiction by simply refilling a prescription. This can eventually lead to seeking multiple doctors. Since most doctors are reluctant to prescribe these medications to teens, they will often begin purchasing the medications illegally. These pills can be quite expensive when they're purchased from a dealer, which is the main reason prescription pain medication addicts eventually turn to heroin. Heroin is a much stronger form of opiate, but it's also much more addictive and dangerous. If you believe your teen has developed an addiction to prescription medications, it's not too late. Addiction is a progressive disease, so it's much easier to treat in its earliest stages. You should first consult an addiction specialist to see what your best options are for entering your child into treatment. There, your teen can be with peers and see that there's still hope to live a better life without these types of drugs.